July the 23rd is World Sjogren's Day. Sjogren's is an autoimmune condition which is mainly known for affecting the eyes and the mouth and the skin and other areas, causing them to be dry. However, as an autoimmune condition, Sjogren's can affect other parts of the body, such as the joints and the kidneys and the nervous system. The spelling that you can see for Sjogren's has got an S and a J at the beginning, which is confusing, but it is pronounced Sjogren's. I'm going to tell you my story. I've already been diagnosed with having fibromyalgia and chronic fatigue syndrome. Around about 3 years ago, I was waiting to get an x-ray done as I had a chest infection, and I was on stairs at the time. And I was bored in the waiting room, and I was doing that thing where you shut one eye and then another to see if you can read the posters properly, because I'd been noticing some difficulties with my vision, that it was blurry. The day that I was about to book myself in to see the opticians, my right eyelid swelled up red and sore, and I had to get an emergency appointment. During that appointment, I was diagnosed with having posterior blepharitis, which means inflammation behind the eyelids in the glands. The posterior blepharitis can be treated with a variety of lifestyle treatments, and I was advised what to take and do. And over time, we realised that I had dry eyes going on that were causing the blurred vision and that were triggering off the inflamed eyelids. The inflammation came and went and came and went. Eventually, I ended up on long-term antibiotics to try and control the inflamed eyelids. During that time, I also discovered other methods of treating the dry eyes. Alongside this, I'd also been receiving treatment because of the hoarseness that I have in my voice. I'd noticed that it had developed and stuck and had asked the doctor to refer me. After seeing an ear, nose and throat specialist, I was eventually referred to speech therapy. I knew in the background, just through having met someone else who'd been tested for Sjogren's, that it was a possibility. That knowledge meant that I was able to persevere and get myself seen by a variety of clinics and doctors. As my eyes and my mouth were affected, so also was my skin and other areas of the body that can be affected by dryness. I've had all the tests that you can get for Sjogren's, which includes eye tests and blood tests and eventually a biopsy in my inside lip. The blood tests were negative, but between the eye tests and the lip biopsy, there's enough to show that there is something going on in my immune system. It means that I do not have classic Sjogren's and have been classified as having Sicca syndrome. Sicca meaning dry, like as in desiccated coconut, Sicca. Although the diagnosis is not exactly the same as Sjogren's, the treatment in essence is. The only difference between myself and somebody with fully blown Sjogren's is that they can take immune suppressants as part of their treatment. One of the difficulties with Sjogren's is it's such a multi-symptom syndrome, and it crosses over with a lot of other conditions. Like a lot of people like myself, people with Sjogren's may also have arthritis or fibromyalgia, like I mentioned. It means that the treatments involve going to a large number of clinics and specialists For example, I was constantly between the opticians and the eye hospital, the dentist and the dental hospital. I now have a range of treatments that enable me to not be so severely affected. However, having the dryness in my eyes means I have to constantly lubricate them. Having the dryness in my mouth means that my asthma is made more complex and I am at constant risk of chest infections. I have only been able to get as much treatment as I needed because I've looked via the Sjogren's websites, and both the American ones and the UK ones have given me information. That means I've been able to pursue treatments. That's taken a lot of perseverance. One of the reasons why this video is so important to share with your loved ones and your friends is this. If you are on any medications that cause dry mouth or dry eyes, or any of the other areas getting dry, then the treatments that I use might be useful for you. Say, for example, you're on antidepressants or you're on painkillers and your mouth is affected and you get that horrible dryness in your mouth when you take the medication. That can lead to teeth decay. It can lead to gum disease. It can lead to tooth loss. It can lead to really severe dental problems. And there are ways that you can protect yourself from those problems arising or getting worse if that's where you're already at. Please, would you share my video to anybody you know who might be affected? Which means if you know somebody with Sjogren's, then please send them my channel, because I'm going to cover so many of the treatments that I use. Not many people have heard of Sicca syndrome, but you may have friends who have similar conditions who didn't realise that these symptoms are actually something that can be alleviated. And also, if you know anybody who's on regular medications, it's useful for them to know. Please think of the people today who have a condition that's so unknown that this is maybe the first time you've ever even heard of Sjogren's. It would be great if you could like my page, share my page, and if you could subscribe to my channel. I have 3 years now of solid research into the ways of treating dry eye and dry mouth in particular, and I really want to be able to share them with you. Thank you. Goodbye.